Well, thank you to the folks who are here for our media briefing. We got a bit of a short one, which means we'll have time for questions, really not just about this content, but any content or any questions you might have. Overall, a happy Earth Day, everyone. On this Earth Day, I can't think of a better way to start it than really talk about the following initiative. Back in 2020, we developed a plastic bag task force to look at the role of plastic bags have in contributing to litter in our community. That work has been ongoing, even though it's been tougher because of the pandemic. But however, we have Michelle DeHaven and Tanya Brownlee-Wee, if I said that right, here from Wichita State, who we've teamed up with to help us really take a better look at this. They are from the Wichita State's Environmental Finance Center, and they are conducting a study on litter in Wichita. So this study will help us make decisions on how to reduce litter in our community and protect the natural environment. Our goal, of course, is to make decisions based on data, to make decisions based on really research. So we are very happy to be working with the experts at WSU to help us with this. Now, the Environmental Protection Agency's Trash-Free Waters program estimates that at least 80% of trash in waterways comes from land-based sources. So improperly disposed solid waste threatens the health in drinking water, soils for farming, wildlife, aquatic ecosystems, public health, and the economy. So the Wichita Litter Study will help us determine the impact of trash on Wichita's lands, creeks, rivers, and streams. So with that, we will welcome Michelle up, who will tell us more about their work. Michelle.
Thank you, Mayor. I really appreciate the introduction. I'm Michelle DeHaven with Wichita State University's Environmental Finance Center. And as the Mayor mentioned, we are conducting a litter study to really look at a snapshot of the data of the litter that's all around Wichita so that we can condense that down into some data that the city and the community can use. So we need the public's help in this. This is your opportunity to become citizen scientists. We will have collection events, data collection events, where you will be able to come out to specified locations where we will pick up litter, we will look at it, we will catalog it, we will count it, we will tally it and record it and properly dispose of it. And then all of that information will come to the Environmental Finance Center where we will analyze all that data that's been collected. There'll be 12 different places across Wichita, and we will collect from those locations twice. So if you are interested in being a part of this wonderful project for our city, you can go to www.wichita.edu/Wichita Litter Study. There's a volunteer interest form there that you can sign up for and let us know what times and days work best for you. And then once you're signed up there, we'll be in contact with you once those dates for those collection sites are set. So we're really looking forward to kicking this off and seeing what kind of data that we can get to use for the city. Thank you.
Excellent. And they'll stand by for questions if you have questions about the work, but we are asking residents to volunteer to help with the study and be a critical part in helping shape Wichita's future to be greener and healthier. So please, if you're able or interested, please reach out and make sure that you can be a part of this. So the last press conference we had last week, we actually had a lot of questions about our housing program and what the update is with that. I asked for Sally to be here, but my understanding is they are overwhelmed right now processing these and really didn't have time to step aside and come help out in a press conference because, frankly, they have received actually, I got a number for you. To date, they've received 3,098 Wichita Emergency Rental Assistant Program applications. So she has hired additional staff and is busy trying to process these applications. So I do have some numbers, though, for you all based on, I think, some of the questions from last week. So we have And like I said, we have more right now than the 3,098 because these are ongoing. They keep coming in. The program is something that is showing to be a need in our community. And it's successful at this point because we have been able to weed out fraud. We've actually had bad actors who have made fraudulent claims. That's part of why it takes a little bit to process this, is we want to make sure that it is getting to the people who actually need it, and that we are being good stewards of the federal taxpayer money. But also, earlier this week, we've hit $1 million in outputs, in payment outputs, which is pretty amazing. So that is $1 million in rental assistance to people who qualify in Wichita who might otherwise be falling further behind, or might otherwise be dipping into their savings account or using high interest credit cards to pay this down, and frankly otherwise be put in a much harder financial situation at best, which means when we bounce back fully from the pandemic, they would be at a disadvantage. And we are stronger as a city when every member of our community are in the strongest position they can be economically, and also as far as health, mental health, and of course physical health. So we are very excited that this program so far has been so successful. We are acknowledging that we need to process these or do additional work to process these applications quicker. But again, our goal is to get the money to people who need it while cutting out those who are trying to, participate in fraud. So one of the next steps we're going to do is really reach out to our landlords and property managers. We want to talk more about this program and make sure that landlords and tenants continue to utilize this service and answer any questions from that end, from the landlord, landlord and property management, to let folks know what is available so they can also reach out to their tenants. So we anticipate being caught up on the application process over the next 8 weeks. And from my understanding, is I think we're still quite further ahead than the state program. And Wichita is the only city right now this far ahead with getting this money out into the community to people who need it. So we're pretty proud of that. And again, it's just thanks to our incredible staff, such as Sally Stang, who, because she is focused with her eye on the ball, so that we can continue to do this good work. She couldn't be here, but it is a program that I've been following, so I will attempt to answer any questions if there are technical questions about the program, and we look forward to continuously giving you guys updates.
That 3,000, those are new applications?
Today we're at 3,098, I believe, total that have been received.
Let's say all those are legit, no fraud involved. Would they be able to be helped, all 3,000 of those applications?
If all 3,000 of these, we'd be hitting very close to that $10 million we approved, which is huge. I mean, we want to get this money out into our community. We don't want to send this money back to Washington so it can get distributed to another community. So, by putting $10 million plus into our community to families who need it, again, there's an economic impact to that, in addition to a personal impact and to a people impact. And one of those economic impacts that we got to think about is for every dollar that comes in from federal programs into our community, it turns over 2 to 3 times. So that's just a ripple effect of economic activity, which results in opportunity. So if all 3,000 of these applications were, everyone got what they needed, and there was no fraud, and they meet the standards that we are required to have, then yeah, we would be pushing up against I think the amount of money that we have allocated to spend this year, which puts us in another good position. Because frankly, and I don't want to get ahead of myself, but frankly, if we were able to be so successful in administrating this program and continue up the pace that we currently are at, then we would probably reach out to the state and offer our services to help them take care of this area. The state right now is administering their own program. We work alongside that program. We could have, I think, defaulted to them, but we thought we could do it better, and frankly, we're showing we can. But we're all in this together. It's all hands on deck. So I think that if we were to get to the point where we're out of money, then our goal would be, well, what's our our role in helping others? Looking towards the state, who also has millions of dollars that they are looking to spend in this region as well, we might be able to help them administer that utilizing our practices, which are at this point more superior to anyone else in Kansas who's trying to administer this program.
Landlords are cooperating. I'm not sure what the rule is with the COVID, but they need to have patience, I guess, with these folks while their applications are being processed.
So it's more of a technical question. I'll tell you roughly, but take it with a grain of salt. What I know is the CDC has put a stop to, during, I think, the winter, put a stop to evicting folks who, for reasons of payment, pretty much for reasons of payment, not, you could be evicted if other violations of the lease. Now, there's still a process for that. It's not automatic. You actually will have to contact our office, and we will send out the paperwork you would have to present to your landlord in order to qualify for that. Now, as far as cooperation goes, I think that in this case, we have to just do a good job letting people know what this program is and how it differs from other programs. I think we have some folks, and that's, like I said, that's going to be my job next, is to what more can I do to help explain how this program is different than other programs that may have popped up in the past, right? And we might have landlords who have experience with Section 8 or experience with other types of programs, and just think that those programs are a lot of work. This program is different. Our goal is to focus on getting money out, getting people securely stabilized in their apartment, in their home. So the process is quicker. So there might be some misunderstandings about this, and our goal is to get as much accurate information out as possible so people can make the right choice.
We have seen that initially we saw a blitzkrieg of people applying, and now it's slowed down to about 15 to 25 applications a day.
Okay. 15 to 25 applications a day for those who are watching online didn't hear Megan just confirm that. So yeah, and again, if you are applying, there is a different pot of money from the state versus the city. We want people to obviously don't apply for both. That's a good way to get your application pretty much pulled off to the side to have more eyes on to get it slowed down. So other than that, we have our COVID numbers are around 4% right now. We are still encouraging folks to get vaccinated. It's really tragic to hear about, I think we had 2 more deaths last week. It's really tragic to hear about folks who are catching this virus and who pass away from it at this point, because we know it's preventable. Our vaccines, whichever one you are offered, is 100% effective against being put in a hospital. So we want to encourage folks to take advantage of the new stipulations that the County Board of Health has put out, which is they're accepting walk-ins. Of course, if you're someone who's on a tight time schedule, then you can still make an appointment. You'll get in, you'll get out. You can utilize our beautiful old library, taking in, I think, the architecture that we've had a lot of discussion about. But more importantly, if you're just on your lunch break driving past and you want to stop in and get vaccinated to ensure that you're safe, but also those around you, those who interact with you, are safe, then that's available. We just are at a position now where we can get our arms around COVID and actually start containing it, but it's going to take all of us, just like it did with masks, just like it did with social distancing. Now, I mean, the science is overwhelming. Just almost half the population in the U.S. has had at least 1 dose of a vaccine, and we haven't seen any of the conspiracy stuff. None of that's happened. We haven't seen any issues. And that's just our country. That's not even talking about the millions around the world who have also received the vaccine. So I think the we're showing that it's safe, and also it's a lot more safe than catching COVID. That's for sure. So we want to encourage people to take advantage of the Sedgwick County Health Department, which I think it's next week or maybe it's now. Where they are changing their policy so that you could just walk in and get your vaccine completely free.
I do have one question on the littering. Yeah.
Yes, you should go here. If not, I'll just wing
Just
it.
one.
Yes, littering's bad. Yes, but we'll have you give the real answer.
It'll be quick, I promise. There's littering where people just throwing wrappers out the window, and then there's dumping, in streets and on the edge of town. Are you focusing on just that, which kind of littering? They're both littering, but I know dumping is a huge problem too.
Right, so at each of the locations, we'll have a very specific area. So all of the locations are inside of a city park. And so there'll be a very specific measured off area inside of there. And we do that for data so that we have good, valid data to present. And anything that is inside of that area will be counted. So if somebody dumped their old couch there, that will be counted and noted. And then we will call the city and the proper authorities to have that removed safely. But any kind of litter that's out, we will be sure to mark and catalog and record so that we can put that in a final report. That answer your question?
Yep, sure.
All right, any other questions on anything else? Look forward to seeing you guys next week. Thank you all.